New data shows Americans keep getting reinfected with COVID as more variants emerge. According to an ABC analysis and compilation of state-provided data, more than 1.6 million cases of reinfection have been reported across 24 states, and those numbers are still climbing. ABC News medical contributor and physician at Stanford Children's Health, Dr. Alok Patel, joins me live now for more on this. Dr. Patel, thanks for being here. You know, back in May, the CDC said reinfections are still possible even with protection from prior infection and vaccination. So how soon after having COVID can you be reinfected, and does it make a difference if you're also vaccinated or not at that point?
Well, good morning, Diane. You know, I think the definition of when you can be reinfected after COVID consistently is changing, with some people saying, oh, within 90 days, you should be protected, whereas once upon a time, it was several months. You know, pre-Omicron and Delta, we had some early studies saying that if you had a previous infection, you were up to 80 to 90% protected from reinfection. That has completely changed. And I think we're at a point now where we need to redefine our metrics. And generally, the expectation for people out there for what natural immunity or vaccine-acquired immunity really means, because you mentioned 1.6 million reinfections. Fortunately, the reinfections look like they're less severe, but we know with these new variants, they're able to escape immunity while we have waning antibody levels and relaxed attitudes, people going back out there without a mask, while we still have 80% of this country at a high level of community transmission, according to the CDC. So you put all that together, and we are going to be living with COVID. It's here. We just have to figure out how we're going to approach this on a seasonal basis.
Now, an ABC News analysis of data collected by the CDC found breakthrough COVID cases and even deaths have reached the highest point since vaccines were introduced, with more cases occurring among the vaccinated in March and April of 2022 than among the unvaccinated. So can you walk us through what exactly that means, and if you think booster shots could help lower that risk?
You know, Diane, that portion of vaccinated versus unvaccinated is tricky and has become a talking point for people who are playing down the effectiveness of vaccines. Simply put, when the majority of the country has received a vaccine, even partially vaccinated, meaning one shot, not two, or two vaccines and not a booster, then inevitably when we see these reinfections and hospitalizations, we're going to see them in vaccinated individuals. We are talking about people who may have gotten a vaccine in early 2021, now with waning immunity levels, and with Omicron BA2, 1, 2121, 4, and 5 in a smaller percentage out there. So that is going to happen. That's why we need to pay close attention to what the plan is going to be going into fall. A lot of us are going to be closely watching that June 28th FDA meeting, where they're going to talk about a strategy for possibly variant-specific boosters, including news about Moderna.
Now, let's talk about that, because Moderna says that its new COVID booster shot shows a superior, quote, response to the Omicron variant. Could that make a big difference in these reinfection rates?
You know, I'm glad that you acknowledge that it was them saying it was superior, because we want to see the data. You know, basically what Moderna is introducing right now is what we call a bivalent vaccine, meaning part of it is the ancestral SARS-CoV-2 strain, another part's that Omicron strain, but it's the first version of Omicron. We are now dealing with all these stepchildren of Omicron. So the question remains is this going to be what we need going into fall? Moderna is saying 8 to 9 times more protective. We'll see what the FDA says, but Diane, at the end of the day, if we don't have congressional funding, we're not going to be able to get out there, but we need to see, is this going to be the protection we need, or is this going to turn into what we see with an annual flu shot?
All right, Dr. Alok Patel, always great to have your analysis. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.